My name's Stephanie Dewese, and I've been with Gilbert Oncology Department for about 3.5 years now. I'm a registered medical assistant, working primarily out of our Glasgow office.
My name is Brenda Strange. I work for Gilbert Oncology Department, and I've been with the clinic about 14 years, but been doing chemo for about 10.
Here in Glasgow, all three of our doctors are oncology hematologists. So aside from having cancer patients, we do see hematological issues. So in this area, we do see a lot of lung, a lot of breast, bladder, head and neck. And aside from that, we do have a lot of lymphomas, leukemias. We treat also patients with more of the blood issues. They may have anemia or just a lower white count or things that we need to help monitor.
Our doctors can treat cancer and they can treat blood disorders. So if you're anemic, you don't know why you're anemic, they check all those things out. If it's your blood cells have quit making red blood cells and stuff, they do bone marrow biopsies, they send that off for pathological review, and then all of that comes back and the doctor can decide, do you need iron? What kind of iron do you need? Or there are some blood-borne anemias that's like leukemia that you actually have to get treated with chemo to kill the bad cells so that your good blood cells can perform.
So we are a fully functioning office. We have doctors here 3 days a week seeing patients. I myself am here every day to help facilitate questions and phone calls and patients' concerns. We have our infusion room where we give full chemos 3 days a week, injections. We have radiation right up the road. So patients, a lot of times, they're doing both radiation and chemo. So we're fortunate that radiation is not 5 minutes from here, and a lot of patients are there and then come over to us and spend the day with us getting their infusions. So in our infusion room, we currently have 4 chairs, which means that we can have 4 patients in here with an IV where we give most chemotherapies are an IV medication. It varies as far as the length that could take to run. Sometimes they're here for just a couple hours, and sometimes they're here as long as we are, 7 and 8 hours during the day.
Here, they learn us. Kendall Rush is the nurse that works with me most of the time, primarily here. And we have a 2-check system. We go in there, we mix the medications, we double check each other on the dosage and how to mix it. We research if somebody is a diabetic, can it be mixed in something that won't hurt their blood sugars and stuff. So we do a lot of stuff that pharmacy does. We calculate our doses, so we're very well trained in that area, and we try to stay on top of that so that the patient gets every little detail. And once they learn that you know that, and we kind of, when they first come here, we explain that to them. If you don't see us in the room with you for a minute, it's because we've gone to mix your drug, and both of us have to check it. Then we come back, so they understand why we're running backwards and forwards and not in the room constantly with them.
Cancer's a scary word, and our patients come in very fearful and not knowing what to expect. It changes every day, and there's information. You can't watch TV without seeing a commercial about some sort of chemotherapy or new cancer, and there's just information everywhere, and it's a lot to take in. And as a patient or someone who's not an oncologist, it's hard to take all that information in and know what's pertinent to you or not. So we want our patients to feel as comfortable as possible. We want to make sure that they're confident in the doctor's decision and the plan that they've put forward with them, and that they understand that they're not in this alone, that we are here always to help them and to help guide them, and that they're not coming in every day to fight this big ugly word by themselves, that we're here to do that with them.
So we try to keep it real relaxed and make them comfortable in their setting. And it's really, we get to know the patients and their families, and I think I'm at the stage in my life that I understand what these patients need. I understand the families involved. I live in Allen County, so I'm from a rural community, but it is the hometown setting. They do feel like they can call you by your first name. They don't, and we talk, I understand the rural community. A lot of these farmers that live around here, they don't want to come in here and actually, they don't want to be sick. They don't want you to treat them like they're sick because everybody else treats them like they're sick. So when they come in here, we try to talk to them about normal stuff and things that are going on in the community and stuff, and you know, get them involved in conversation other than their illness.
Our patients are wonderful. It's inspiring every day. You have patients who come in who are, you know, really not been handed good news, and they're fearful, but you see them come in with their families and the love and support, and you see their strength in their decision, and they get up every day and they come in here and they take treatments because they have a faith that they're going to be better and that they're doing the best thing for themselves. And that in itself, and just watching their strength and how much they just fight is just empowering. And who wouldn't want to be a part of that?